Good evening, everybody. Good evening, Dr. Aumatma. Thank you for being here today and chatting with us.
Thanks for having me here.
It looks like it's a beautiful sunny afternoon and not yet dark on
Yes,
the West Coast.
yeah, yeah, we're having really good weather right now.
Oh, that's so good to hear. Um, so for those of you who haven't yet met Dr. Aumatma, I'm so excited to introduce you to this amazing doctor. She's a naturopathic doctor. She has a master's in nutrition. She's been practicing medicine for over 10 years, and she specializes solely in fertility, pregnancy, and postpartum. Dr. Matma is also the best-selling author of Fertility Secrets, What Your Doctor Didn't Tell You About Baby Making. And she's a sought-out speaker on fertility, women's health, women's empowerment, and we got along so well when we met recently that we decided to open up a chat with you to introduce you to what she's up to and the really unique ways that she takes care of her fertility patients out in Berkeley, California, as well as an upcoming online fertility summit that she's involved with, and she's going to tell us all about what to expect on there. Dr. Aumatma is also the Best Alternative Medicine Practitioner Award winner, and that's in her local practice in California, and she consults with clients in the Bay Area as well as long distance. So thank you so much. I know you are a busy doctor as well as a new mom, and so thanks for taking the time today.
Absolutely. It's so much fun to see you again.
So where do you want to start? I was really intrigued to hear about your unique treatment style. So maybe we can jump into that. When women and men are going through fertility treatments, they're used to a certain structure of how that all rolls out. And what a client, a particularly client who doesn't necessarily live in the Berkeley area, can expect is so different than the norm. So tell us what happens when you welcome a new client into your practice and she or he don't necessarily live in the Bay Area.
Yeah, so we have a lot of clients. They come in from all around the world, and we wanted to create a system that could be just as effective for people that don't locally live here, and also people that are local. So our system, like the overarching principle stays the same. Phase one of our program is detoxification. So how do we remove all the things that are kind of blocking a couple's fertility? And I say a couple because we really don't, at this point, we don't accept women unless they're single and trying to conceive on their own. If they're in a partnership, we only work with the partner, work with both people. So detoxification is step one. And during this phase, we're also doing a lot of the kind of progressive testing, I would say. So many women come in with like, here are all the hundreds of lab tests that my OBGYN, my reproductive endocrinologist, all of these tests. So they'll come in with that data. We can, obviously, if we're working with someone long distance, we can review that data by them sending it to us ahead of time and kind of review it and then talk about it over video. I feel like technology has just taken away some of the boundaries that we used to have, back in the day.
Yeah,
So
it's really transformed the way that care can be delivered.
yeah, absolutely. I have patients that just live like an hour away in San Jose, but sometimes the traffic in the Bay Area is so bad, so they'll often say, "Oh, I don't feel like coming in for an appointment. Can I just do it by video?" I'm like, yeah, that's totally fine. So it's also convenient for local Bay Area people to not have to travel. Um,
Yeah.
so as I was saying, we go through the detoxification and then continue with the progressive lab testing. There's a lot, I'm sure you do the same thing. We have a lot of like alternative tests that actually help to give so much insight into what's happening that could be underlying the fertility issues.
Yeah.
So those they can do. If they're local, we kind of hand them the test kits. If they're not local, we can usually send the test kits to them. There's a few states in the US that have funky laws around that, so we do the best we can with those. Um, and then the next phase of the program is the rebalance. So usually by phase 2, we've kind of like gotten all of the test results, we've collected all the data while they're doing this detox, and then we can start with rebalancing. So it's really this phase is like helping to rebalance the hormones, but it's also like making sure that we address all the underlying issues. So sometimes they have gut inflammation, which is causing a lot of the issues that they're having. I just have a patient that got pregnant. She's had 3 miscarriages, and we've been working together for 7 months now. And she got pregnant unexpectedly, but she's like, this is the first time that my pregnancy doesn't actually feel like it's attacking my body. And it's just like the perfect way to describe it, because she has thyroid antibodies, and my guess is that her gut gets really inflamed when she's pregnant because she had a huge number of food sensitivities. So it was like so perfect the way she described it, because she's like, it's not, it feels like it's not having a war inside of my uterus. And I'm like, wow, you're so in tune with what was happening. It's unbelievable. But
Wow.
if she told a regular OB that, they're looking at her like she's crazy. To me, I'm like, oh yeah, you probably have an autoimmune issue that's causing this imbalance.
Right.
So it's really great to make sure that we kind of discover the root cause and address the root cause before they try to get pregnant again, if
Yeah.
they've tried and been successful but had miscarriages. And then the last phase, so that part is probably the largest part of the program. And then the last phase is the mind body phase. And that's really where we address any of the mental, emotional, spiritual blocks that are in the way of someone conceiving.
Yeah.
And that has a lot to do with I particularly practice 2 different mind body techniques. One is homeopathy, which a lot of us practice and are familiar with. And then the other one is something called body talk, which is probably less popular, but it's been fascinating because I will like body talk has a way of asking questions and understanding what's happening with the body from like asking yes or no questions. And the more I've asked questions of patients' bodies, I can see like, oh, your sadness or grief from this last miscarriage is getting housed in the uterus. So if you ever get pregnant again, all of that is going to come up again and probably repeat that cycle, because you your body kind of is like holding on. It's like the cellular memory is still there that feels like grief or sadness or anger. A lot of women have trauma, usually sexual trauma that they experienced years ago, and they'll kind of continue holding that cellular memory even if they've done a lot of the psychological work that is having an impact.
Yeah.
So yeah, so that's kind of the overview of the program. The program slightly shifts when we're working with someone long distance, because for the rebalance phase, we're doing a few different hands-on therapies that last about 12 weeks. Actually, no, sorry, 6 weeks, but 12 treatments over the course of 6 weeks. So when someone flies in to work with us, they'll fly in for a week and we'll do like back to back to back treatments to kind of squeeze everything into 6 days. So we basically take the 6 weeks and kind of compress it over 6 days. And that seems to work pretty well. So far, so good. I haven't had any issues with um, like the people that are super committed that are like, I've tried a million other things. This is like so comprehensive. I just want to do one thing.
Yeah.
Uh, then that kind of helps change the conversation for them in terms of like, oh, I can just go and like get these treatments and like most of my patients become like family anyway, but the people that come from out of town more especially become family because they spend so much time together with us over a short period of time.
That's amazing. I love the idea of that fertility treatment immersion.
Yeah, that is a great way to describe it.
Can you tell us about your own philosophy? So I noticed that one of the things that you write about is having a baby when you're ready. What do you mean by that?
That's a great question. So I am really passionate about women choosing when they're ready to have a baby. So a lot of times we're kind of we feel the ticking clock, and instead of really stepping back and saying like, hey, is this the right guy to be with, to have a baby with, we like dive in because, oh my god, like options are so limited, and they run out of time and whatever else there is. um, so there's that piece. There's a lot of especially in the Bay Area, but I feel like a lot of women are coming into their purpose, which is not solely about having families anymore, right? Our purpose is like we have a big overarching purpose of our life, and then part of that is having a family. So it's kind of like, well, we should be able to live our highest purpose, and if that means that we don't want to just have a family and stay at home and like raise a child, that should be our choice. And like nothing wrong with not choosing that, but it's also nothing wrong with choosing our purpose or a career or our passions before deciding that we were ready to have a child, right? So
Yeah.
it's like so many layers, and I've heard so many women like come back from reproductive endocrinologists discouraged because REs will essentially say to their patient like, why did you wait so long? What's wrong with you? Why are you 42 and now coming into my office? And it's a little bit disheartening because it's like, well, what about the woman's choice of I want to focus on something besides family before I'm ready? Um, and I feel like that's totally reasonable. So it's it's walking that fine line because I also don't want to encourage patients to just say like, oh, I'm gonna wait and wait and wait and wait and maybe get to 50 and then decide I want to have a child, because yes, there's still like it's still within reason, right? Like we have the uterus and ovaries, and more specifically the environment that's affecting our uteruses and ovaries that is probably unlikely to change. So as much as, I don't know if you've read this, but Dr. Christian Northrup talks about in Women's Bodies, Women's Wisdom. She mentions how there are women in other parts of the world that choose to have babies at 60. And to me, that's like, okay, that's wonderful. That's amazing for understanding the capacity of the human body. But it's also important to remember that we have an environment that's affecting us, and we have our work stress and emotional relationship stress and whatever else, like all of these factors that are consistently affecting us. So it's that, like, if you're choosing to wait, choose to do that actively or proactively so that you don't get to 42 and you're like, oh my God, I waited too long. Now what? But rather you like prepared yourself and you took the necessary steps to optimize your health way before you even get to that point of I'm ready to have a baby now.
Yes, and I agree. This is such an important discussion and point that you've raised because right now, one of the most popular fertility related treatments is egg freezing.
Yeah.
So when I I was a participant at the Canadian Fertility Show in 2018. And
Mm.
at that show, I noticed that a number of young women, one of the new questions and one of the most common questions that I did receive was, should I freeze my eggs? And I thought, well, I don't know, but if you do or you don't freeze your eggs, what else are you planning to do to preserve that fertility potential? Because it's not just that we can blame infertility on old eggs.
Yeah,
Uh,
we forget the other half of the equation, which is still in our bodies. It's the uterus. So we can freeze our eggs all we want, but sure, and that might increase your chances when you're ready to have a child. But if you're not doing anything to quote unquote freeze your uterus, um, then
yeah,
you're missing the other half of the equation. And I put that in quotes because I believe that there's a way to freeze or reverse your uterine age and ovarian age within your own body. So you can like optimize your health and optimize your lifestyle to kind of stretch out your fertility for later in life. Um, but not, I think where a lot of people get mistaken is, oh, I froze my eggs, I'm fine. And they kind of like put it aside and like decide that they can put their fertility on the back burner till they're ready. And they're going to walk into some clinic at 43, 44, 45 and say, okay, implant those eggs, I'm ready.
yeah,
And unfortunately, it may or may not work. And the success rates on frozen eggs is pretty low. It,
mhm.
I think I read somewhere it's 1% of frozen eggs actually turn into live babies. So you may get pregnant, but you may not have a child because your uterus really doesn't have the capacity to sustain a pregnancy if you've waited till 45, you've drank, smoked, had a shitty lifestyle, stressed yourself out. You've done all of these things that help to age your uterus. Uh, and then you're walking in and saying, why can't I get pregnant? I froze my eggs. What's up?
Yeah,
But it's kind of like fertility clinics aren't telling their patients like, oh, by the way, just freezing your eggs is not going to be the magic trick. Like you still need to do other things.
yeah,
And there's no education, no support for the other things that women should be doing.
yeah. It's really reductionist, and it doesn't have great research yet on success rates. So, whether or not you chose to do egg freezing, and that in and of itself is quite an investment, invest in your health and well-being, because a baby isn't made from just putting a sperm and an egg, having a party together. It's
Right,
then everybody would have their baby after their very first IVF.
right. Yeah, yeah,
Tamsin is saying the disconnect between conception and a live, healthy birth is something that most people don't get.
yeah.
Yeah,
Yeah, it's so true.
that's why we're talking about this, right? Because
Yeah.
hardly anyone is talking to women and men about this idea of fertility preservation,
Mm-hmm.
that fertility is a function of our health,
Mm-hmm.
and that can infuse more health back in and actually reverse some of the aging or effects, as you say, of this external environment by creating a healthier micro environment or inner environment.
Mm-hmm.
I love
Yes, exactly. Yeah.
So, what is going on with your upcoming fertility summit?
So it's not actually a fertility summit. It's going to actually be amazing for almost all women, regardless of whether they want to get pregnant or not. It's called the Post Birth Control Awareness Week. And the idea of it is, how is taking birth control and or choosing to get off of birth control affecting our hormones, affecting our fertility, affecting the microbiome of the gut, affecting nutrient levels. Like there's so many layers of impact that being on birth control or being on birth control for years and then getting off of it is having that impact on our bodies. And honestly, like almost, I would say what the stats are like at least 50% of women in the world take birth control, right? Like this is affecting a huge amount of women.
Yeah.
And it's not something that I've organized, but one of our fellow colleagues, Dr. Jolene Brighton, has kind of organized this huge thing. And she has different tracks. So if you're really excited about, like, you want to learn how birth control is affecting your gut, you can be on this one track and you can just like listen to those sections. If you want to figure out how it's affecting your fertility, you can listen to that section. So she's done a really incredible job of like bringing together experts from really around the world that are at the cutting edge of this connection of birth control and how it's affecting the various levels of our life and our bodies. And yeah, and I think that one of the pieces that I'm really excited about is the collection of all of these thought leaders kind of is starting to break the shield of, oh, birth control doesn't affect anything. Birth control is totally fine, right? Like, how many times have you been to your endocrine or your OBGYN and heard them say, oh, it's totally fine for you to be on birth control? Yeah, it's not going to affect anything. And the truth is, in life, in practice, we see something completely different. So there's a disconnect between what we're being told as women and what's actually happening, as well as there's like tiny bits of research, not a lot, but tiny bits of research that are coming through. And what I would hope is that this kind of awareness inspires more people, more researchers to research deeper into what's actually going on. Like, we really need more data, and we need to know, like, here are all the negative effects that could happen from taking birth control. Here's your options. Or if you've been on birth control, don't freak out. It's okay. Here's what you can do to like support your health and restore your health if that's your scenario, right?
Yeah, it's hugely important, Mama, and I'm so excited about the summit. And I would say I have conversations every single week with clients who are concerned about what effect having been on the birth control may be having on their current fertility, or if they're not yet ready to have their baby and they want to work on preconception, which is awesome too, but they don't know how to come off birth control and not deal with the symptoms that the pill was actually masking of more than likely hormonal imbalances. And the pill, for some women, might feel better, and for some women, they can't tolerate it at all.
Mm-hmm.
Feel terrible on almost every single oral contraceptive or even hormonal IUD that they try.
Yeah.
And I think this is a women's empowerment or women or feminism issue because, you know, it's a huge population that of women that are using this, as you mentioned.
Mm-hmm.
I just don't know how many, you know, I just don't know if 50% of men were taking a drug, and a lot of them had concerns about it. If we would just let it ride and tell them it was okay to be on that for life, and you know, honey, just when you're ready to get pregnant, just come see me, we'll get you pregnant.
Yep. It's like, it's increasing the dependence that women have on interventions, because it's just like, it's become the norm, right? Like, sure, just take birth control forever, tell your body, no, you don't want to get pregnant. And then when you're ready to get pregnant, we're just going to like do IVF anyway.
Yeah.
Yeah. So I really, and I think what a little snippet of what I've shared in the interview with Dr. Jolene is like what's not talked about a lot is the effect of the birth control on the uterine lining. So
Right.
again, right, we're going back to the uterus. Like we are missing the boat in terms of fertility if we're only talking about ovaries. That's
Yep.
50%. That's like saying, yeah, we don't need to talk about sperm because who cares? As long as there's one sperm to fertilize this egg, it's okay. Versus, I'm sure you're the same way. Like the naturopathic approach is like, no, your diabetes is affecting your sperm. I don't care what the numbers look like or how great they're swimming. The the quality of your sperm is going to make a difference in your fertility. It's the same thing. It's like the quality of your uterus is going to make a difference. Your gut lining is vital to the health of your baby.
Yeah,
Yeah,
exactly. All of this not only helps the individual, man or woman, but the outcomes with epigenetic programming and basically the health inheritance that you're passing on to the next generation. It's vital that both parents are calling in their optimal health even before conception too.
yes, yes,
So
absolutely.
how can women join in on the upcoming post birth control awareness summit?
I shared the link. Does it show up? I don't know if it shows up in the
Let's see.
team
I
chat.
don't see it yet, but we will make sure that it's there below the comments. So that's where we'll send the link to sign up. Yeah,
Yeah.
that sounds perfect.
Okay.
And
Awesome.
well, if people want to reach out to you and learn more about how you practice and your clinic and your program, how do they reach you?
Holisticfertilitycenter.com. And I highly recommend, even if you're not sure you're ready to have a baby yet, you can fill out our How Fertile Am I quiz, which helps kind of put you in a place of figuring out where your fertility is at and if you need to start taking steps actively to have a baby when you're ready.
We love quizzes.
Yes. Yes.
That
They're
sounds
so fun, right?
so much. Thank you so much, Aumatma, for sharing your passion and your knowledge. And I can't wait to see the summit and hear more about what you're sharing there. And look forward to chatting with you again in the near future. Thank you so much.
Thanks for having me.
Ciao for now.
Bye.
Bye, Matma.